Well, thank you for attending our webinar today, folks. I appreciate that so much. Today, we're going to be talking about how much can you earn as a medical billing company owner. That's right, you can own your own medical billing company. That's what our company has been doing for the last 27 years, and I'm here to tell you more about it. Let's talk about this just for a second, because you know what? There are a lot of people out there who have no idea who I am. So I'm showing you a picture here of me and my wife and my family and my kids back in 1987. I think is when this picture was made. Yeah, I'm Patrick Phillips there on the right. That's when I had no gray hair at that point. And well, we were just starting our medical billing company, working out of our home right here in Fort Worth, Texas. So it's been 27 years since then. We don't do medical billing ourselves at this point. As a company, we train and support other people like yourself, and have for the last 27 years all over the United States. My wife and I started the business, like I said, in 1987. We started doing the billing, and then by 1990, early 90s, we decided it was time to start, coming up with ways to teach other people how to do this. So I did that very thing. I tested out a lot of different marketing ideas, how to actually engage with doctors, how to get them interested in what we have, and well, here we are today. So thank you. I see all of you typing stuff in there, and wow, somebody says they can't see my shared screen. So that makes me wonder if I'm actually broadcasting like I should be. In my little preview window here, I see my slides. So maybe that was typed before I turn that on. Okay. Well, in any case, my name is Patrick Phillips. I am the founder of American Business Systems, and here's some of the books that I've written. You can find these out on Amazon.com if you'd like to know more about me. I am going to talk about the book in the middle there, which I co-authored with a doctor, Dr. Vicki Rackner, and you'll see why that we developed that book to let you and our other, we call them licensees, that's people who've gone through our training, who've paid the licensing fee to get into our program. We've trained them to use that book as a marketing tool. That's right. Hey, I'm also a member of the editorial board of BC Advantage Magazine. You can find that out on the internet, BC Advantage Magazine. It's a print magazine, over 40,000 subscribers. They've been in business for many, many, many years, and have, well, everybody that's in this industry subscribes to this magazine. And so I'm on the editorial board. I write articles on a regular basis. I'm also on the advisory board of MRMA, M-R-M-A-A. That's the Medical Revenue Management Association of America. And as you can see, it's out there at mrma.org. So be sure and go check that out. And you'll see all of the wonderful board of advisors that we have for that organization. And it is a tremendous organization. It's the one that actually certifies you when you go through our training and become an ABS licensee. We refer to our company, by the way, as ABS, American Business Systems, and it is a licensing situation. So we refer to our people who've gone through our training as licensees. Well, okay, with that, I think I can start here talking to you a little bit about the system that we use itself. Let me put that slide up here, and you'll see that we actually have a cloud-based medical billing system. Now, what that means, folks, is that we don't have any CDs or DVDs or other ways of you installing software on your computer hard drive, because that's old-fashioned. If you are talking to any company that's trying to put you into this business and they say that they have a semi-cloud-based system or something like that, they're trying to fool you, because they have actually a server-based software. The server means their hard drive, and that means they've installed the software on the hard drive. It resides there, and so does the patient data. If the computer's stolen, guess what's also stolen? Yes, the patient data goes with it. So anyway, we're just letting you know that ours is cloud-based. That literally means you could buy a brand new laptop right now at Best Buy, take it to a McDonald's or any place that has a Wi-Fi connection, and log into our system and actually run your business from that location. Not one piece of software, not one iota of software has to reside on your hard drive. And of course, neither does the data. The data resides on our redundant servers that we have in several parts of the country, in different electrical grids. They're called redundant servers. And that means if one server went down right now, all of our users would automatically instantly be switched to another server, and they literally would hardly even know that that glitch had happened. Now, that hasn't happened for some 20 odd years, but I'm just letting you know, for those of you who are paranoid about stuff in the cloud, that's how secure it is. And yes, it is HIPAA compliant. We have a lot of different things that we're going to be helping you with. And one of them is the services that you see here that you can offer to doctors. Now, this is all included in our licensing fee. There's nothing extra that you buy after you've paid our licensing fee. You go through the training, you get all of these things, and you can optionally offer any of these services to the doctors that are in your area as well. So there are multiple streams of income that can be made from this. I want to show you a quote here that I ran across that I think is important for you to know about. It's from the Doctors Patient Medical Association Foundation. Look what it says. 2 out of 3 doctors say they are just squeaking by or in the red financially. Now think about that just for a second. Let that sink in. 2 out of 3 doctors say they are just squeaking by or in the red financially. That's hard to believe, isn't it? Now, it wasn't just because of the whole COVID thing that we went through last year. It's because doctors are not real good business people. You can ask anybody who's worked for a doctor in the past or does now that you know, are they good business people? They'll tell you no. They are good doctors. They were trained to help people get well, but they really don't know diddly squat about, running a business. And that's why they're squeaking by financially. So I just thought that was an important quote that you should think about. That means that there's opportunity for you. And one of our partners in this business is Dr. Vicki Ragner. She's a retired general surgeon who speaks to doctors groups all over the United States on how they can build their practice and be thriving in their practice. And she's the one that co-wrote the book that I showed you earlier. Look at this quote from her. The physician's pain is your opportunity. She wrote this specifically talking about you looking into this business. That doctor's pain that they have, folks, is something that you can solve. You have the remedy. I'm going to show you that you can solve that. And while you're doing that, you're going to be making a lot of money working out of your home. Yeah. By the way, I've got the question box open here. I see a lot of the questions or comments, I should say, that you guys have put on there first. Thank you. And I'm also seeing any questions that come in. So, here's one already. Rachel says, I'm wondering if I become a part of ABS, how do I become my own business? Am I creating an LLC? Yes, Rachel, that's one of the entities that we talk about in our training. We go through that in detail with you. We can hold your hand through that process of creating your own LLC or setting up your company any way you want to, of course. Now, here's a quote from Dave Jacolo. He is a part of the Healthcare Business Management Association. He says, here in yellow, as you can see on the screen, if you don't have sophisticated claim scrubbing software like we do, it's not unusual to have a 35% or higher claim rejection rate. Now, here's what that means, folks. When you submit a claim for a doctor, you're using our software, but it goes through what's called a clearinghouse. Ours happens to be the only one that we know of that's built into our cloud-based system. So you don't send it to a third-party clearinghouse like you do with all other systems. But the point is that those clearinghouses can reject those claims for all kinds of reasons, human error, and of course, all kinds of reasons why they want to reject it. They want to keep the money in their bank account, right? Not share it with you. So in our case, we have a cloud-based system that the rejection rate is less than, hold on, are you ready for this? Less than 2%. That's right, not 35%, but less than 2%. Now let that sink in for a second, because what does that mean to the doctor? It means more money that they get to retain, right? Instead of collecting, instead of billing 100,000 and only collecting 65% of that or 70%, we're collecting 98% of that money. That is why we have a unique advantage in the marketplace, our built-in clearinghouse. And if you're not sure what that means, ask your ABS rep and find out more about that. Now, look at this. National health spending growth is projected at 5.4% annually through 2028. Okay, This is from Health Leaders. You can see that up here at the top of this slide. Back in March of last year. Yeah. And so a growth in any industry, folks, at 5.4% is just unheard of. It's unheard of. And that's the industry to be in. If you want to be in an industry of any kind, that's the way to do it. Here's from Medical Economics. It says almost 80% of surveyed participants felt positive about their respective outsourcing relationships. When it comes to outsourcing for your medical practice on all your billing processes, it only frees up your employees' time to work on the things that they were hired for, but it also unkinks your cash flow. Yeah, and then look at this one from Cranes. New York City doctors struggle to stay independent in a changing industry. Doctors in private practice have always had to balance the demands, oh, I can't even see that myself, I got something in the way, of running a small business with providing the best care for their patients. But the challenges of keeping the waiting room open are growing amid declining reimbursement rates from insurers. Again, those dang insurance companies don't want to reimburse the doctors. They want to keep the money. They do all they can to do that. And that's why our technology, along with you, serving the doctor as an outsourced billing solution can solve that problem. Yeah. And then from Current News Magazine, it says the global medical outsourcing market is projected to register a compound annual growth rate of about 10.5% during the forecast period of 2018 to 2023. Now, what that means, folks, is that this particular industry, it's called the medical billing outsourcing market, is going to grow 10% during that period of time. And it will only continue to grow further beyond that. Believe me, it's just it's unbelievable how big this market is. So if you're going to get involved in a marketplace, believe me, the medical marketplace is a great one to have. Okay, here's another question here. Yeah, Rachel says, does ABS get a certain percentage of my income since I'm a franchisee? Will ABS receive royalty fees from my business? Great question, Rachel. But we're not a franchise. That's why we set it up as a licensing situation. We're referred to maybe as a business opportunity license. And so with that, there are no royalties and there are no percentages. Once you've paid our license fee up front, there's nothing after that that you ever pay again. Isn't that good news? Yeah. Okay, the revenue cycle management market is estimated to be around $40.4 billion. Now, I can't emphasize how important this quote is from HIT Consultant. It means, folks, that the industry you're in is such a huge pie. If it were a pie chart, all you need is a little bitty slice as tiny as one little line to make a real good income. You don't need a whole big slice or percentage of 40.4 billion, but that's how big this industry is. It's 1/5 of the entire financial market in the United States. Yeah, the whole thing is 1/5 of our gross domestic product. So good industry to be in, huh? Here's another article. Physician groups undertake an organizational mandate to transform from volume to value and not sell out to hospitals, Black Book reports. See, some people have heard that doctors have sold their practices, and a lot of them have said that they would like to do that if they could, join hospital groups. Some of them did that, and guess what's happening right now? The move is back away from that completely, and they are basically saying that they agree that they prefer an advisor with revenue cycle management expertise. Now, the whole process of collecting the money in a doctor's office is called a revenue cycle. Yeah, so you become, once you go through our training, a medical revenue manager. We call you that because you're not just a biller, you're actually managing the revenue inside the doctor's office, and most doctors prefer that. Yeah. Okay, so anyway, look, these quotes are all in our slide deck, which I'm going to put over in the handout section right at the end of the webinar. So be sure and download that, and you can see all these quotes up front. Now, some people ask, well, what is this business all about, Patrick? What will I do to earn back my investment? Let's say, and by the way, if you haven't gone to our website, it's there at the bottom of the screen, absystems.com. Go out there and look under one of the titles at the top. I think it's called what is my income or something, what's my potential. And you'll see that your investment in this business is about $28,000. It's like a franchise fee. It includes all the training, all the support, all the marketing materials, all the ongoing training, all the upgrades, all the new codes. Everything is included in that, folks. You never pay us another dime. You can ask any of our licensees, and I'll show you how to get a hold of some of them if you'd like to call them and ask them. And just ask them, what have you paid ABS since you became one of their licensees? There is no more investment. So it's real simple. At one point when my wife started, of course, we were doing all this on paper. Now, you've still seen this piece of paper probably in your own doctor's office, right? Something like this. Haven't you seen something like this before? This is called a day sheet. It's basically a piece of paper that the doctor actually circles on it the common things that they see wrong with people and the common procedures that they do. It just saves them time because there's literally thousands of these codes that they have to kind of keep up with. There's a big book of codes that they can buy that's just huge. So in our system, all those codes are built in, so you don't have to worry about that. So in the old days, using paper, you would take this paper and put it into your system. Now, this is not given to you as a piece of paper in our system. All of our system is completely paperless. And so the paperless part makes it easy for you to not have to worry about storing paper in your home. Medical records have to be kept up to 7 years, the government says, but we do it all electronically. We have electronic ways of storing all this nowadays in the cloud. But you do take the same information from the doctor. It can either come through our electronic medical record system, meaning the doctor is seeing the patient, they're using their iPad or tablet, they tap on a few codes, those codes go into our system, and then they're ready for you to actually do a little cleanup and some other things that you use to submit the claim. That's how simple it is. So either way, whether you have to enter some things for the doctor from an electronic version of this piece of paper here, or the doctor has already put that into the system, it is all totally electronic. Now, illustrating that, the doctor there is holding an iPad with our electronic medical record system called EMR-X. That basically is something that the doctor can use to put the data in about the patient while they're seeing the patient, and it goes right into our system. Now, our system for billing is called iClaim. It's all one system, but we just have two things, electronic medical records that the doctor uses in the office. On our end, you're using the iClaim billing system. We've illustrated in this screenshot here that clearinghouse. The clearinghouse is a part of our cloud-based system. Remember, it's not a third-party entity, it's built in, so we're trying to illustrate that here. So once that clearinghouse function is completed inside of our system, which is, again, instantaneous, but it is a process where it goes through and scrubs it, makes sure that everything's filled in like it should be, that all the codes match up and so forth, and then it forwards it electronically to the insurance companies and, of course, to government entities like Medicare. That's how it works, completely, totally in the cloud, electronic. Folks, you could actually take that laptop I mentioned earlier to Hawaii and work on the beach if their Wi-Fi reached there. Anywhere that has a Wi-Fi connection, you can run this business. That's what's great about it. This is an actual screenshot, by the way, of the iClaim system. We're just kind of illustrating to you there how user-friendly it is. You'll see all the choices that you have here on the right-hand side, up at the top. Very sleek, modern looking software, because it is. And the great thing is that it's constantly updated, meaning anytime you log into our system, you'll log in just like you would at your bank, for example, to do your online banking. You'll have a username, you'll have a password, and one other code that we have you put in. And once you put that in, you're there, you're looking at it right there and can use it from any device that's connected to the internet. I told you you could do this whole business on an iPhone, but it's kind of tiny. I don't know about you, but I couldn't see it that well. So it's better to use it on a laptop, a desktop, or even an iPad is fine. Once you pick one of the choices at the menu at the top there, you'll see that under billing, there's all kinds of things there that you'll be doing, including payments and claims and so forth. And once you get into the system, you'll see that there are ways of picking the codes. I told you all the codes are built in. In fact, we even have the old previous codes. You see them up here at the top. There's ICD-10, This is the International Classification of Diseases. So this is what could be wrong with somebody. As you can see, there's some listed here, but you put that in, it immediately comes up with what it is. Like in the code, if the doctor gave you the code R05, it's a cough. You see it right here. And then once you go into the actual billing part, you're actually just putting in some dates that the doctor saw the patient. This is the visit itself that the doctor can charge for. And the cost for that can actually be put into the system, so it automatically fills that in, $114. Then this one has an immunotherapy 1 injection, whatever that is, and that is put in and instantly shows up here as well. So again, since it's cloud-based, all of this is retained from moment to moment in real time on our servers. Then when you get ready, you simply go down at the bottom where it has a button called Create Claim, and that claim is created. Now, one of the things we wanted to cover today is, how to help doctors increase their revenue, but I wanted to first show you what your return on investment. You've heard that term, haven't you? ROI. Well, right here on our website, you'll see there is an income potential tab, and you just click on that, and then medical billing income calculator. Now, in this case, it'll already have some numbers filled in, but we're going to just talk about those numbers just for a second. Notice that the first thing it wants to know is the number of doctors that you'd like to have as clients. So obviously, we'd like to have at least one. We put a 1 in here. Average number of patients each day the doctor sees each day is 25. Some doctors see much more than that, believe me. Average number of days the office is open is 5. That can change if they take a day off or something. And then the charge. Now, you're going to be charging the doctor based on their specialty, their volume, and all kinds of other factors, a percentage of the money that you collect for them. In this case, we have about the lowest percentage that I've heard licensees charge, 6%. Usually nationwide, that runs 6 to 8%. So somewhere in there, you can punch in any number you want here to see what it is, and it has an average claim amount of $100. Now, folks, nowadays when you see a doctor, I don't know many doctors you can see for less than $100. Some of them many more dollars than that, depending on the type of specialty and so forth. But again, plug in your own numbers, hit the submit button, and you'll see that in this instance, we've come up with a figure of $39,000 gross that you'd be receiving each year from that doctor's office. That's what you would be billing them on a monthly basis, of course, but $39,000 or about $3,250 a month. Now, when we say gross, that means in business that it's the amount of money that you take in. Doesn't mean that you're not going to spend some of that money. If you've hired another person to actually do the billing and you're just overseeing it and maybe making contact with doctors and growing the business and managing the employees, then of course you're going to have a portion of that you have to pay your employees. But if you're doing all the billing for this one doctor's office, you'd make $39,000, except for what miscellaneous expenses you might have around that. Your phone bill each month, your cell phone, your internet charges, all kinds of things that are all tax deductible, by the way. But that would be, your money before your net. So again, if a doctor is seeing 25 patients a day at $100 per patient, that's $2,500 a day that they should be bringing into that particular practice. $2,500 a day times 6% is your average earnings of about $150 a day. That's what you're earning. That's where we came up with that $39,000 a year. $150 a day, but what you don't realize is that that's for less than 90 minutes of your time. That's right. Those 25 claims that we talked about there for that doctor during that day's time would only take you about 90 minutes. All right, let's say it took you 2 hours. Still, pretty good hourly wage there, isn't it, for doing the billing, working in your underwear. I meant your pajamas. Out of your spare bedroom. Yeah. So at $150 a day times 5 days a week, maybe that's all you want to work. You don't want to work more than a couple of hours a day. That's $750 a week. In a year's time, you've earned $39,000. That's how we came up with that behind the scenes there. But go out there and plug in your own numbers and see what happens. Now, we went ahead and did it on 5 doctors because, folks, to be honest with you, you won't be able to do the billing yourself for probably more than 5 or 6 doctors. So we're going to use this illustration to illustrate if you just change this one number here, 5 instead of 1, what would you be earning? Let's hit the submit button and see. Yeah, okay, now it's getting interesting, isn't it? $195,000, and you may be willing, you may be earning, I mean, you may be working a full day there. You know, might be putting in 8 hours a day for that kind of money. But that's 16,249 a month. I'd say that that's kind of a good wage for doing this business. Running your own business, folks, is the only way to go. $195,000. Now remember, that's with 5 doctors. You could have 5 different practices, and each one of those practices might have 2 or 3 or 4 or 5 doctors in the practices. At that point, you probably have to think about hiring people, but those people can work remotely from you anywhere in the world that has an internet connection. That's right, they can work from their home as well, and you can monitor what they're doing with the technology that's available to you. So it makes a wonderful business to grow as big as you want to grow it. And I'm going to pause here just for a second to see what the questions are. Ryan says, who are some of your competitors and what differs you from them? I think you're explaining it via your slides, but what is your main competitive advantage, or do you do things that differently with your competition? Yes, Ryan. One of the things I mentioned, of course, that our competition is going to have software that comes on a CD or a DVD, or maybe you download it from them, but in any case, you install it on your computer. Now, if you want to connect with the doctor's computer and be able to allow the doctor to see, you know, some data and reports and things like that, and you have to actually put software on their computer as well. Then you have to have a third piece of software that you then connect between you and the doctor's office. The real competition that's out there is not, you know, the other medical billing companies, though. That is the doctor's office themselves. You have to somehow show the doctor why, you know, it's advantageous to them to outsource to you. And I'm going to get into that here in just a second, Ryan. Just kind of hang with me, and you'll see that there are real good reasons why you'll want to join us and go with us instead of somebody else that's doing something similar. Well, there are multiple streams of income available to you as an ABS licensee. Now, what do we mean by that? I showed you the illustration earlier that was a stack of boxes that had these names on here. Every one of these are services that we have via our technology partners that we've partnered with that can provide other services for the doctor that you can make money on. Now, each of these will make you some kind of income, not the kind of money that the billing will, but the point is that there is some money to be made in all of these. Whether you offer them or not is always up to you, and I'm going to cover some of those and tell you what they are right now so you can kind of get a feel for that. QUICKCOLLECT, for example, as you can see, it says it can replace a collection agency. That means the doctor does not have to go after the money that's owed them by their patients. You know, some patients don't have insurance, or they have a certain amount that they have to pay towards the bill, and doctors are billing patients all day long, sending out bills, and then they only collect nationwide about 50% of the money that they bill for. That includes turning it over sometimes to a collection agency, and our service, QUICKCOLLECT, can bring in 3 times what the collection agency can bring in. And you make money on that. Yes, you're charging the doctor something for that service, but believe me, we can still collect a whole lot more than they're going to pay us for the money that we collect for that. Again, without using collection agency, you know, you're not on the phone calling people, you're not sending out letters. This is all done electronically through our cloud-based system that does that. Yeah. And what can you make on that? Well, you can make about $10,800. Now, the reason, oh, sorry, I went past that too fast, didn't I? Let me go back. The reason I put that number up there is because if you talk to your ABS rep, they can kind of give you some details as to how each one of these services can earn you money. But there is potential revenue. This is based on 5 doctors on the QUICKCOLLECT system, but you could earn another $10,000 a year. And once you've got this set up, this is what I call mailbox money. Yeah, you just go out each month to the mailbox and collect your check from us of $10,800 a year. That is a real easy way, folks, for you to earn money and not have to add any more hours to your time. Then there's our service called AUDITGUARD. You know, every doctor that sees a Medicare patient are under the microscope. They can be fined up to $10,000 for each infraction if they overcharge or charge the wrong fees. And AUDITGUARD provides an audit of the physician's current records by certified medical coders. That's right, you don't have to become a certified medical coder. We have certified medical coders that work for us that do this AUDITGUARD service for you and for the doctor's office. It protects the doctor from those $10,000 fines. And you can earn another $18,000 a year with this service as well. Again, mailbox money because you're not doing any of the work for this. Remember, our certified medical billers and coders are doing all of this work for you under your auspices, under your guidance, and the doctor will never know anything other than it's you doing these services. AutoCard is an automated follow-up system that you can personalize and schedule for the doctor to be mailed to their patients. Yes, it's a postcard or a greeting card that comes in the mail. And there's over 18,000 in our cloud-based system that you can choose from, and many campaigns that have already been designed just for your purposes of following up with the doctor with their patients. Hold on just one second. I had a little tickle in my throat there, so I had to pause there. By the way, you can also use this AutoCard service. We have campaigns designed for you to actually use in your marketing to doctors. So once you've made an initial contact with the doctor's office, they're not going to sign up, let's say, that day with you, but you want to keep your name in front of them, right? Automatically, this system can do that for you for your own clients and customer follow-up as well. All right. With the AutoCard service, again, with just 5 doctors, you could be making $12,000 additional per year. So as you can see, it's mounting up, isn't it? Each one of these services can earn you several $1,000s more per month, per year, and you are not doing anything but going and getting your check. By the way, that even sounds old-fashioned now that I say that. The check is, it can be mailed to you, but it can also be just deposited right into your bank account as well. Then there's our service called iDocs Now. All doctors must keep their records for a minimum of 7 years. That's a law. This allows you to offer a secured cloud-based storage solution that's 100% HIPAA compliant. And it's a great system, folks, for getting rid of all that existing paperwork in their office and putting it in the cloud. Again, with 5 doctors, you could be earning $6,000 per month off of that service as well. Are you getting the idea? Is it sinking in now to you that we've got some pretty cool ways of you earning revenue? So we can increase the doctor's revenue, but we can also make you money as well. Isn't that a great combination? What other industry can you think of that makes you money, but it also makes your client money? Because each one of these saves the doctor money or increases their revenue. And so they're all a part of managing their revenues, $6,000 more per year. Again, you don't do anything to manage that other than going and getting your check. CODERITE, here's another one. It opens up a huge market for our licensees by offering coding services to physicians. You don't have to get a coding degree. You don't have to go to school and learn all those medical codes. Folks, I would venture to say 98% of all of our licensees that have gone through our training and are now running their own business have never had any training on coding. They don't need it because it's built into our system. You can increase doctors' revenue and reimbursement rates up to 30% by using the correct codes, though. So we take some of the doctors' existing records, run them through our CODERITE system. Our certified professional coders do all this for you through a secure scanning to a coder's work queue where they look at all this stuff and they send us back reports to the doctor that shows that we've increased their reimbursement rates up to 30%. Again, think about that, what that means to a doctor. They didn't do anything different except run their codes through our CODERITE system to find out if they're the correct codes. For some things that the doctor sees a patient for, there could be another 5 or 6 codes that they pick from. They want to pick the correct code, but they don't want to undercode as well. And that's where most doctors go. If they have a choice between 5 codes, they'll pick the lowest reimbursement. Or the person working for the doctor will do that. Why do they do that? Because they don't know any better. And they're scared of being, audited by Medicare. So we provide this service. Yes, it costs them some money, but again, far less than it brings in for the doctor. Again, with 5 doctors on CODERITE, you could be earning another $12,000 a year. I know that's nothing to sneeze at. For some people, it's extra burrito or 2 here and there at Taco Bueno. So just keep in mind that these are all services that you can offer if you want to. It's always optional. Okay, I see another question here. Rachel says, will these extra features cost the licensee? No. Rachel, no, never. All of these services are provided to you as a part of your license fee with us. You get these automatically as a part of your package. I say they're optional only because you don't have to offer any of these to a doctor's office if you don't want to. But you'll see that they're great door openers and they can actually add extra income on the back end. Now, the doctor does pay for the services of CODERITE, for example, but that's included in your proposal to the doctor. When you set them up, you make a proposal that includes what services you think that they need, and they can pick and choose and take some out if they don't want to use them. But the point is, you show them that for a small fee, they could be getting their codes corrected, and in this case, up to $48,000. Now, I put together a little chart here just to kind of show you, and I didn't update that top number there. We were using different figures, but you remember it was $195,000 for the iClaim, claims themselves that you would billing the doctor for, your 6% or whatever that you charge the doctor. And with all these other services, you see, they add up pretty fast, don't they? Now, folks, this has potential to make, again, as you can see, $250,000 for some people. So it's nothing to sneeze at. I even have several licensees that are making close to 7 figures in this business. And I've interviewed those, and all those interviews are out on our YouTube channel, which I'll tell you more about as we go along here. Yeah, oh yeah, look at all the sparkles coming up there. Okay, I don't know why I took time to put that on that slide. Okay, let's go to the next slide. Can we? Oh no, it's going to go through all kinds of sparkles there. I don't even know if you guys can see that happening. It's some kind of effect here built into Keynote on the Keynote program. I'm trying to get past it. I can't. I don't know. Oh, it did go past that, didn't it? Where did that come up? It was 240,000, I think, that it came up with here. But since we were a little low on that 182, yeah, it's about $250,000 if you really change that top number to 195. Okay, that's nothing to sneeze at, folks, for a business you can run out of your pajamas in your spare bedroom. And yes, we have licensees that I've interviewed that will show you that and tell you that. Okay, here's another question from Ryan. Can we market your system to doctors in all 50 states? Yes, you can, Ryan. You can bill for doctors in all 50 states. Can you talk about how you help market your system to new licensees? I think you meant how we help new licensees market to the doctors. So I'm going to address that here in just a second. Oh, look, that's the next slide here. Get in front of the doctor. That is the first and hardest step, to be honest with you. Folks, look, I'll be honest with you. If no matter what business you buy into, you're going to have to find clients. Now, some of those are retail businesses, like if you opened a Subway sandwich shop, of course, you don't have to do a lot of marketing. Well, let me back up. You got to spend a lot of money at first with flyers and postcards and things, maybe ads in the newspapers or on the internet to get people to know that you're open and get them in the door. So everybody spends money on marketing to clients. In our particular case, it's a little different the way we've worked this out. I'm going to show you that now. That's a very important question, Ryan, because this is the scary part for most people. What if I spent $28,000 on your license fee, Patrick, and I end up never getting a client? Well, here's the problem. If you put this on the shelf once you've gone through our training and don't do anything that we tell you to do, you'll never get a client. But if you follow our system, see, we called it AB, American Business Systems, for a reason, you can't help but build your business. And folks, all you need is one client, because this is a referral business. Once you get one doctor, they know other doctors. They will share with other doctors what you have done for them. We'll even show you how to pull those names out of the doctor with ease. Very simple. You could offer them half off on their next month's billing, for example, to give you a name of a doctor. And you tell them, all I'm going to do is just tell them that I'm doing your billing and that you referred me. And it's a wonderful way to build your business. Folks, I have licensees that have clients in all, well, not all 50 probably, but in several states, all over the United States. How did they get those clients? They didn't fly around knocking on doctors' doors. They signed up one doctor in their local area. That doctor knew another doctor, and maybe that doctor was in another state. They were friends. Then we show you how, using technology and the internet, of course, and email and so forth, and the telephone, of course, to sign that other doctor up without ever having to see the doctor. I've got licensees who will tell you, I don't even know most of my doctors, except that they'll have a Zoom meeting, every once in a while to go over the reports that they can provide to the doctor and things like that. But other than that, they've never seen them face to face. So yes, it's wide open. Ryan, you can build this as big as you want to. And by the way, what I'm about to show you about our marketing techniques, folks, is one of the things that sets us apart from our competitors. This is not about selling anything or cold calling. Doesn't that guy look like a salesman? I don't know what he's selling there, but the point is, you don't have to be that kind of person. You have to do exactly what we tell you to do and let all of our marketing materials do the selling for you. Yeah, I'll show you what I mean. When you approach the doctors using our proven methods of marketing, they consider you a resource, not a salesperson. You're going to be providing that doctor with information and education. That's how you market in today's world. Look, what am I doing here today with you guys? You haven't heard me try to sell you anything. I mean, you can go to our website and sign up for our training and so forth, but I'm not trying to sell you, am I? I'm educating you. I'm teaching you exactly what you need to do to get into this business and what this business is all about. That's what you'll be doing with the doctors, with the marketing materials that we've developed. You're going to be able to share with that doctor good information that they'll welcome. And oh, here's a good question from Rachel. Rachel, I'm going to save that one if you don't mind until we get there to the actual training section. Okay, it's about training and why it's only 5 days. Okay. Well, the number one method of getting in front of doctors is called networking. Now, maybe you've heard of that. Before COVID, you would go to a networking group like a Chamber of Commerce or something like that in person and give out your business card and meet people and tell them what you do. And, it was a physical thing to do. But it's still the number one method that licensees have reported in getting their first client. After all these 27 years, it's still the best way to do it. The difference is that now we can do it electronically, virtually. That's right. There are networking organizations and groups on the internet, even including Facebook and other ways of setting up meetings with doctors where you don't have to meet people in person. All you're really looking for when we teach you how to do this networking virtually is you're looking for power partners who target your same market. In other words, this could be somebody who sells to doctors. Maybe they sell, I don't know, rubber gloves and other supplies. Well, they're selling to the same market, right? Doctors, but they're not selling what you're selling. What you are selling is you and an increased revenue for the doctor. So they're not your competitor, but they certainly go after the same market and the same prospects as you'll be going after. We're going to show you how to connect with those people in your community and have them introduce you to the doctors. Doesn't that sound a whole lot better than you just going out and cold calling or knocking doors or calling people on the phone? No, we don't do that. And we're going to show you all the different networking groups that are available in your area. That's part of our training, is to show you and help you find all of the people that you can connect with in your area. There are more groups and organizations on the internet than you can imagine, including LinkedIn, for example. LinkedIn is a great place to connect with power partners as well. Okay. All right. So I think this is just showing you some other organizations. Yeah, there we go. There's some other places that we're going to, again, point you to, teach you about, show you exactly how that works. And you are going to be connecting with those power partners that will introduce you to those doctors that they know. The number two thing that will help you in marketing to doctors is to have a competitive advantage. Yeah. What is your advantage over the other people that are out there? Well, one of them is this one. I've kind of hinted at it, that it's a cloud-based system, that it's all integrated. But look, we've illustrated here for you so you can kind of wrap your brain around it a little bit better. The practice management system itself, this is what we call the billing system in a doctor's office, the practice management system, because it does manage their practice with all the patient data and so forth that's in there. This is iClaim. Now, iClaim is a way of going into the doctor and putting this all this data that they give you into our system electronically. And if you wish, you can give the doctor and the staff access to this system, because we have a built-in scheduling system, for example, that they might want to use. We have an eligibility part of our system, which means as they are seeing the patients, they can click a button by putting in their insurance number off of their insurance card into our system. We can go out and electronically grab the data in real time from the insurance company on that patient and put it into our system. There, now you don't have to type anything in. Name, address, phone number, all that comes in from the insurance company. So that's built into that as well. That's why you'd give access to the front office, for example. Then remember, I talked about the doctor actually seeing the patient using our EMRX. This is the electronic medical records system that we have. Again, these are not two different software systems written by two different groups of programmers. It's all in one system, but we separate that in your thinking and their thinking, that this is what they use primarily, the doctors, and then you do the billing through iClaim. I've already mentioned that our clearinghouse is the claim scrubber, and it does all the submissions for you to the hundreds of insurance companies that are out there, submitting that in the correct format that they want to see it in. And then if you've ever used a patient portal, you are going to love our patient portal. Again, written by the same programmers as iClaim, EMRX, and the clearinghouse. But it is one of the best ones that you'll ever see out there. It keeps all the patient records, everything about their subscriptions, their appointments, everything. And it's available to the patient from any device that's connected to the internet, and of course to you as well. All that's put in. So it's all integrated. This is all one system. That's your huge advantage over other companies. Look, other companies have literally 4 or 5 pieces of software that you have to install on your computer. Again, if you want to connect and communicate with the doctor's computer, that has to be installed on those as well. And it's just pieced together with what we call here in Texas, bubble gum and baling wire. Bubble gum and baling wire. That's the term we use when you're just kind of hooking things together and they're not really connected like you'd like for them to be. Then I mentioned the clearinghouse there, how the information goes in here and goes to the insurance companies. We've already talked about that, so we'll move on. And then you'll want to be showing your expertise. This is one of the things that helps you stand out from your competition. How do you do that? Well, we have presentations that are already designed that can either be printed out on a flip chart like this, or electronically that you can use to show the doctor exactly what advantages you have over the competition. Those are slideshows that we've developed that we give to you, that you brand with your own company name and information. We also do live demos for your doctors. That's right. you can set up on our website for licensees an appointment for the doctor to see a demo of our system. They're interested in knowing what technology you have that's better than what they're using now, and we can show that to them and answer all their questions. We do this. You're on there as well, from your computer as well, so you can watch and hear everything's being done, but we're doing all this for you. And no, there is no additional charge for that. That's a part of you being a part of our nationwide network. Now, why do we do all this? Well, it's real simple, folks. We don't charge any extra after our licensing fee because we make a few pennies on all the services that I've shown you. And so we do these demos for you at no cost because we want you to sign up that many more clients. Does that make sense? From an ongoing revenue as our company, literally, folks, we could sell no more licenses and still run our company from the revenue that we have on the back end. And that's what's great for you, is that you don't ever have to worry about us nickel and diming you to death. Another way you show your expertise is you partner with our partner, Dr. Vicki Ratner. I mentioned her earlier. Here's some of the books that she's written. You can go search her out on the internet if you want to. She's also been interviewed on radio programs and TV programs and magazines, newspapers all over the United States. She helps doctors thrive in medical practice, and in our case, helps our licensees connect with those doctors, which helps them thrive. She and I wrote a book called A New Thriving Medical Practice. I'm showing you this because, as you can see at the very bottom there, there is a place for you to actually put your name. Right on the cover of the book with us will be your name, forward by, and then there's your name. In this case, it says Susan Smith, if you can see that. And then it says, comma, CMRM. Can you think about what that might stand for? Certified Medical Revenue Manager. That's right. So those are the initials you can put after your name once you get certified through our training. Your name will be on the inside cover, title page. It'll also be at the end of the forward with your contact information there. So folks, this is a personalized, almost like a marketing tool, like a business card. Doctors, if they go out to Amazon, will see that this book is $24.95. You're going to give it to them. That's a part of your marketing, is to just give that to them. And then you get a big supply of those with your package, of course, but then you can reorder them as you need to at our printing cost, which is less than $4 a copy, with your name on the cover. Okay. And then number 4 in your process of connecting with doctors and being standing out from your competition is to know their pain. You have to know what the doctor's pain is. Look, if the doctor just came in and you walked into a doctor and they said, oh, well, you need this, 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 and this, but they didn't examine you, you'd think that's kind of strange, wouldn't you? The same way with the doctors. We don't try to sell them anything. We ask them questions about their practice and then come back with a proposal that shows them what we're going to do for them. We know their pain. We're asking questions like, is your current system server-based or web-based? How many claims do you do a month? What are you currently spending on your billing, etc. We have over 3 pages of questions that we've come up with that you'll set and go through, usually with the office manager or whoever's in charge of the billing. But we'll show you how to get to that person and connect with that person through the doctor themselves. I'm just looking at some other questions that are coming in here. And again, I'll get to all of those here in just a second. We want to get through this. Well, gosh, it's only top of the hour already. Well, one of the things we call this is the practice analysis questionnaire. And as you can see, there's one that we've actually started for a particular doctor. Again, it's about 3 pages long. Then when you come back, you're going to show them what their pain is with this report. It's called a practice revenue report. You'll plug in some numbers into our software here that then generates this report that you can take back to the doctor. And look, the doctor's going to do the same thing you did probably. When you saw this, you glanced right down here and you said, increased revenue per year. Look at this. For this particular doctor, using common numbers that we would get from a doctor's office, they're going to earn another $27,700 a month or $122,000 a year. Folks, that's nothing to sneeze at. Believe me, doctors will pay attention when you show them this report. This does all the selling for you. Oh, there it is enlarged there so you can see that a little bit more clearly. See, here's our rejection rate of 2%, and their rejection rate was up above there. I think it was about 25%. But the point is, it'll all be different for every doctor, but it will be something that will open their eyes and get their attention, believe me. All right, so number 5 in this whole process is you have to have a plan of action. Folks, once you go back to the doctor with our professionally designed folder here that contains all the flyers and the report, the actual proposal itself, we have all that already designed for you. We've created those. They're templates that you simply fill in for that particular doctor, take it back to them, leave it with them if you want to, and then just follow up the way we teach you. And about half the doctors that you give one of those proposals to will be signing up with you. It's just that simple. There's a little bit closer look at the proposal that you'll be printing out. It's usually about 10 pages long. Remember, all of this is done electronically. It's all done on your computer. It doesn't matter what kind of computer. It could be an Apple, which is what this looks like. It can be a Windows-based computer, a Chromebook. It doesn't matter. Remember, since it's cloud-based, as long as you can go through a browser to the internet, to our site, and log in, you are using our system. Okay, there's training. This is illustrating the training that you get once you've gone through our initial training, and I'll talk about that here in just a second, but there's ongoing training that we provide and our technology partners provide for you. You also have our support. We have over 100 people nationwide from coast to coast that can support you in any aspect of your business, from setting up your business to getting your business cards to setting up your LLC. All that is our support, and of course, helping you find your first client and future clients, helping you with pricing, proposals, any technology questions that you have. All of that's provided by our support people nationwide. The training is all done now virtually. We used to have people fly down here to Texas for a week, stay at a hotel, and spend a lot of money going through 5 days of training. Rachel, you mentioned that earlier, that training used to be 5 days. Well, you can go through it in 5 days if you want to, but it's 10 modules of about an hour and a half. So what would that be? 2 modules a day, 3 hours a day? It'd be a lot. We suggest you stretch that out a little bit, but you can take it at your own pace. You set this up with your virtual instructor. It's one-on-one with our certified instructors who, by the way, own their own medical revenue management companies. And so they're actually out there doing the business themselves. They know what works, what doesn't work, and they can hold your hand through the process of getting your business up and running as they take you through those 10 modules. Folks, if for some reason you still have questions, remember we have a money back guarantee. 100% of your money will be refunded if you go through our training and still don't like what you see. If you just go, you know what, this is not what I thought it was, I want my money back. We've actually given some money back. It's only about 0.5% of the people who've gone through our training, but that's always there in writing in our agreement for you